Some questions we have from Uttar Pradesh Postgraduate Medical Entrance 2013 question paper recalled by the students. Postmortem burns. What is the characteristic feature? Typically if you look post and antemortem, postmortem में मरने के बाद अगर burn हो गया तो no line of redness, vesicle contains air only, base is dry, vital reaction is absent, no increase in enzyme reaction, no carboxyhemoglobin in the blood. Whereas मरते हुए burn हो गया तो antemortem, then you will be inhaling, I mean the dying guy will be inhaling the carbon monoxide, so you will find it in the hemoglobin. More than 5% of carbon monoxide hemoglobin is what you need to basically remember. Yeah? Yeah, contain? Difference. Postmortem burns? Postmortem burn with a clear fluid, whereas serous fluid contains air only or clear fluid, but not serous fluid or purulent content won't be there. That's a fundamental difference. Okay. Yeah. For the Rupam, I think the broadcast is clear. Yeah. What is a grievous injury? This is a very well known question. The section 320, section 319 IPC. They are the ones which define the grievous injuries. Section 320 defines injuries as grievous, which include emasculation, permanent privation, etc. etc. What is 319 IPC will define? Which is not grievous, 319 IPC, but which lead to a hurt, like a bodily pain, infirmity, then you call it as, comes under 319. 20 is grievous. Rigor mortis, what is the mainly useful for? For the assessment of time since death. But in a not very precise manner, but with less precision. That's the point. Then lacerated wound appears like a incised wound in which situation? Incised means straight cut. But tibia of the shin or any underlying bony surface hai to lacerated wound look like a incised wound. Yeah, another very routine question. Cavett test is used for the detection of what in the blood? If alcohol is in options, generally alcohol is the answer. In the high yielding priority list, it comes higher than barbiturates. So, alcohol. So basically, Kojelka and Hein are the methods which are called macro method of detection. Cavett is the micro method of detection. Police guys, they do what? Breath test, right? So, gas liquid chromatography is most sensitive for the medical legal purposes. If you want to detect the presence of the alcohol is what need to be remembered. BOA is basically beta oxalate amino alanine. Last में alanine, that becomes the answer in neuroletherism. Pearl index is contraceptive efficacy, right? Then soiling index is basically for not for soil but for air. वो trick मालूम होना है, So a known volume of air is filtered through a white filter paper under specified condition, and you will identify the presence of the pollutants using the photoelectric meter. That's what you need to basically do. A similar question which can come in entrance exam. All these are the indicators of air pollution except McArdle's sweat rate is not, it is only for thermal discomfort. Then, which index does not measure the pain? Quetlet is for obesity, as all of you know very well. Which is not a measure of central tendency. Mean, median, mode are called central tendency. But what is that formula which you need to remember? Mode is equal to mean minus 3 into mean minus median. आपको मीन देगा, मीडियन देगा, मोड कितना है बोल के पूछेगा एग्जाम में, एंड यू स्टार्ट वर्किंग लाइक पाइथागोरस अलजेब्रा एक्सपर्ट, यू वोंट कम टू आंसर. सिमिलरली मैं लास्ट मॉक टेस्ट में आपको बताया ना, एनपीपीवी, पीपीपीवी, पॉजिटिव प्रेडिक्टिव वैल्यू, नेगेटिव प्रेडिक्टिव वैल्यू, व्हाट इज द रिलेशन विद सेंसिटिविटी स्पेसिसिटी, वो फॉर्मूला है ना, लंबा फॉर्मूला, दैट ऑल्सो यू शुड thoroughly master. Okay, then Aedes aegypti should be less than 1, and what is the other distance? Till how much distance you will maintain it? 400 meters. Indian male who is doing sedentary work like PG preparation, how many kilocalories are required? फिर भी खाना पड़ेगा. हाँ, what is the golden number? But this is one number, if you don't know, 1000 rank. Very good. Now 1000 से भी ज्यादा आएगा, इसमें किसी ना किसी को चूज करना पड़ता है. तो डॉक्टर, दिस टेबल इज इंपॉर्टेंट. सेडेंट्री 2425, मॉडरेट 2875, पीजी में सीट आने के बाद फर्स्ट ईयर में 3800, गधे के जैसे काम करना पड़ता. पीजी होता है गधा. देन सिमिलरली वुमेन ऑल्सो. So these numbers, कैसे भी मक्की मारना, and tomorrow examiner is going to ask the same. Then how much will be the protein requirement also is a favorite question, doctor. 1 gram per kg is what you need to remember. There can be variations of this question. Average Indian woman require how much? First of all, average Indian woman is 50 kgs, वो मालूम होना, और 1 mg per kg means 50 mg is what is required per day. How much of DEC is required? So basically we have to give 6 mg per kg body weight per 12 days into 12 days. 60 kgs individual बोले तो 350 mg. 100 mg का टैबलेट्स आता ना TID, right? Then into 12 days. That's what you need to basically remember. Hetrazon. ESI आप कहीं भी गए, without ESI, without Factory Act, you won't be left. Last time confinement में कितना देना, sickness out of confinement में कितना देना, वो सब. Employer contributes 4.75%. Employee contributes 1.75% of the wages. उसको 10,000 सैलरी आ रहे, 1750 रुपीस. 1% कितना होता है? 1750 और 175. 175. 1750 बोले तो दे विल डू भूख हड़ताल. तो देन स्टेट गवर्नमेंट विल बेयर हाउ मच? 1/8 of the total cost. ESI corporation will bear 7/8. That's what you need to remember. Then sickness benefit, it is payable for a maximum period of 91 days in any of the continuous 365 days. Then enhanced sickness benefit बोले तो क्या है? It is payable for 14 days if it is tubectomy, and for 7 days if it is vasectomy, full wages देना पड़ता. Then there are so many other things. I leave the literature for you. You need to be sure. कितने chlorination होना? 0.5 milligram per liter for a contact period of 1 hour is a standard question in chlorination. Most common type of thyroid carcinoma, endemic population में which one it is? It is basically follicular. And irradiation induced thyroid cancer, Hiroshima Nagasaki, papillary. Regarding the gout, it is the big toes, metatarsophalangeal joint is the most classical location. Wide fixed split means you will remember ASD. Iron deficiency anemia, chronic disease, ferritin level. Then X-ray was discovered by Roentgen, but radioactivity was discovered by Becquerel. Then obstructive lung disease बोले तो FeV1 will be decreased and ratio also become typically decreased, FeV1 by FVC. X-linked recessive is which one? Duchenne's muscular dystrophy. So basically hemophilia, G6PD deficiency, diabetes insipidus, CGD, color blindness, Bruton's agama, globulinemia, classical conditions, X-linked recessive. You will remember me in exam hall tomorrow. Similarly, Calaban syndrome. Then there are two conditions which are called X-linked dominant. Hypophosphatemic rickets and incontinentia pigmenti are the two conditions which you need to remember. A hypophosphatemic rickets is also called vitamin D resistant rickets. Normal anion gap is 10 to 12, as all of you know. Then pleural effusion height, why will you find hyperresonance? You will find dullness. Easy question. Then ankylosing spondylitis is HLA B27, complete biscuit. तो इसलिए एम्स में बहुत बड़ा रैंक आ गया बोल के यूपीपीजी एंट्रेंस लिखते वक्त अगर रोए तो फायदा नहीं है. यूपीपीजी इज लाइक गेट अप, लुक एट द सन एंड स्टार्ट रनिंग. 90% क्वेश्चंस स्टैंडर्ड क्वेश्चंस होगा and you are supposed to answer using Cauda Equina. 10% questions अगर आप आंसर नहीं करें तो भी सीट मिलेगा, provided 90% you did right. Earlier ABPG used to be like that and TNPG used to be like that, but now the trend changed. Our examiners started reading books. So तो थोड़ा हम कोशिश करना पड़ता. We need to be this thing. Weber, and Weber is basically third cranial nerve. So all brainstem syndromes, doctor, one question will definitely come. You will remember me. Weber means ipsilateral third with contralateral hemiplegia along with upper motor neuron type of seventh nerve palsy, all because of the problem in the midbrain. Upper motor neuron type, because seventh nerve nucleus is located in the pons. Lesion is located in the midbrain, उसके ऊपर है. So those descending cortico-pontine fibers are coming to reach seventh cranial nerve nucleus. They get affected. So UMN type, not LMN type of seventh nerve palsy will come because pons के ऊपर midbrain में है lesion in case of Weber. Claude में ipsilateral third with cerebellar contralateral. Paranoid is vertical gaze palsy will be there. In anatomy2medicine.com you have the video library. In that you are having brainstem syndromes in neurology. 25 minutes lecture. Review it if you have not, if you are not having energy to open neurology textbook in this hour. Then Millard-Gubler. Millard-Gubler is basically ipsilateral sixth and ipsilateral fifth but lower motor type. And ipsilateral fifth and lower motor type of seventh. So that combination becomes Millard-Gubler. Then von Willebrand may platelet dysfunction is significant. APTT prolongation also will be there. Von Willebrand may. APTT is what? Clotting factor. Clotting factor deficiency may what will you get? Hemarthrosis. But you don't get hemarthrosis in von Willebrand. In von Willebrand, predominantly platelet dysfunction features will be more predominant. So petechial hemorrhages etc. are commonly in females. It presents like menorrhagia. Menorrhagia. A 17-year-old female is being brought with menorrhagia. Why it is not hemophilia? Hemophilia is X-linked. That's the reason girls may generally दिखाई नहीं देगा. If a girl is presenting with bleeding diathesis means it should be a bleeding disorder which is not X-linked but autosomal. And since von Willebrand is autosomal, it presents like a bleeding diathesis in a young girl presenting with menorrhagia is what you need to remember. Okay. For some of you I may look too fast but you are reaching the verge of preparation and entire year we had also been teaching. No. So freshly once more in the month of February undergraduates will join us. That time we will start from once more where is endothelium, where is von Willebrand factor. For now I am assuming you know. If it is too fast, you can review the video lecture more detailed way in the anatomy2medicine.com. Which type of shock? You will be warm and dry. Typically in a distributive shock like neurogenic is what need to be remembered. Hepatitis B, most commonly you will detect by doing PCR, which can detect even the minutest quantity. Mycosis fungoids में two varieties होता है, localized होता है, advanced होता है. Localized को treat करने के लिए you will be using the total skin electron beam radiation is what you have to basically remember. Huh? Right. Abhiram is asking a very good question, sir. Von Willebrand factor deficiency may factor 8 deficiency will also be there. No. Quantitative also will be there. Factor 8 stabilization factor बोलते Von Willebrand factor को. अगर वो नहीं है तो factor 8 of the patient become quickly degraded. So it is not like lupus. You are trying to use antiphospholipid antibody syndrome. ABDD prolongation is in vitro, not in vivo, right? But yaha in vivo also factor 8 deficiency is there. But hematosis is not a feature. That's the point. Okay. I think Abhiram fully agrees with us. Huh? Sigmund Freud said superego develops when. So three things are there, doctor. ID or id? What is the correct way to call it? Huh? Id? Okay. Id is at birth only we are born, doctor. At birth only, by birth only we know. No, my boyfriend is mine only. I will not let you see him also. Or my girlfriend is mine only. Oh, कोई बोलने से आएगा नहीं. Right? All impulse is id, which comes at birth. Right? Then you are having ego, which develops a little later. Then superego is the one which brings a discretion and tell you what is the reality, what is not the reality. Okay? Children are known for what? Impulsive nature. Geriatric professor of medicine department is known for denial. ये करेंगे सर, हमारे जमाने में बहुत कुछ ये किया, कुछ नहीं हुआ. So he is a mark of denial. It is a young resident like you who has to match a balance between that pediatric impulsive nature. You should be impulsive at every day of life. If you go by rejection, denial, human civilization must have not progressed. So you need to strike a balance the two. Superego will do that. So typically the superego will start emerging at around 5 years. At 5 years is what need to be remembered. And to make judgments, what you require? Superego. To make judgments, what you require? Superego. Shaadi.com में देखे, is this girl fine or not? Decide करने वाले कौन होता है? Superego. Crowd में देख के, if you jump and propose, that is id. No girl, no crowd, still you are hallucinating that you are in the arms of a princess means, that is ego. So between the three. Now doctor, multiple myeloma में, what do you have? You have IgG 53%. G is great, G is gigantic. Maximum what you find is G. A will be there, D will be there, but not M. Multiple sclerosis में क्या होता है? Corticospinal tract demyelination हो जाता है. Corticospinal tract होता है pyramidal tract. Hence you get spasticity, not rigidity. Rigidity where will you get? Extrapyramidal tract. What are the 4 tracts which are called extrapyramidal? Vestibulospinal, rubrospinal, reticulospinal, tectospinal. They are all called extrapyramidal tracts. There you get rigidity. So then, which drug you will not use in candidiasis, doctor? Ketoconazole you don't use. Amphotericin B, fluconazole, voriconazole, and echinocandins also. Capsofungin and micafungin. This is also a favorite MCQ in the exam, which is an example of echinocandin. Rot spots you will find in infective endocarditis. Kusumal sign, you will see it basically whenever there is. What is Kusumal sign? Normally, when you have inspiration, negative intrathoracic pressure will suck the blood from the jugular vein into the heart. So, jugular vein collapses at the time of inspiration because it will drain into heart. Any obstruction in the heart like constrictive pericarditis will not let the jugular vein to drain into heart. So, at the time of inspiration, jugular vein instead of collapsing, it remains uncollapsed and remain prominent, which is called Kusumal sign, is what you have to basically remember. Most common malignant tumor, if it is children, what? If it is adults, what? In children, it is hepatoblastoma, whereas in the case of adolescents and adults, it is hepatocellular carcinoma. Most common brain tumor in the case of the children, classically is astrocytoma followed by medulloblastoma and craniopharyngioma. Typically, in the first year of life, first 1 year of life, supratentorial tumors are more common. 1 to 10 years, infratentorial predominate. After 10 years, once more supratentorial will predominate. This transformation you should not forget. Which is an autosomal recessive cancer predisposing condition, ataxia telangiectasia. You will have ataxia, recurrent sinopulmonary infections, ocular telangiectasia, and the tendency for lymphoreticular malignancies characterize the ataxia telangiectasia. And this is the favorite question. What happens to which immunoglobulin in ataxia telangiectasia? Decreased amount of secretory IgA will be there. Because secretory IgA is deficient, they get all sinopulmonary respiratory infections become more. That's what you need to understand. Congenital adrenal hyperplasia commonly is autosomal recessive in nature. Congenital rubella, typically the most common presentation would be narrow deafness is the single most common presenting feature, is what you need to remember. In Wilms tumor, you have hemihypertrophy, Beckwith-Widman, aniridia. These are all the associated features. Thromboangiitis obliterans में acrocyanosis नहीं होगा, मगर smoking की वजह से आता है वो. So Raynaud's phenomena will be there. Medium to small sized vessel occlusion will be there. How will be sigmoid volvulus? कैसे घुमाएगा? Typically it will be anti-clockwise is what you need to basically remember. Then what are the important buzzwords on sigmoid volvulus in entrance you will not forget? Bird beak appearance, ace of spades deformity, bent inner tube or omega loop sign, and Paul Mikulic's phenomena is the typical treatment. Whenever there is any impending gangrene, you will basically do anastomotic surgery is what you need to understand. This question I have given you in the mock test today only to irritate you. You may think, अरे ऐसे questions क्या है सर एग्जाम में आया? यूपी पीजी 2030 में डॉक्टर जबुले किस देशवासी है? हाँ? और नेक्स्ट एग्जाम में who is that young person who got Nobel Prize from Pakistan? Huh? Malala किस देश के वासी है? Will be a question. Huh? So Dr. Jaboulet, who invented the eversion of the sac of the hydrocele surgery, is a Frenchman, is what you need to. So who is the father of modern surgery? Ambroise Paré, right? Father of Indian surgery, Sushruta. And father of bacteriology, Louis Pasteur. Physiology, Claude Bernard. Psychoanalysis, Sigmund Freud. Antisepsis, Joseph Lister. Modern anatomy is Vesalius, right? And tomorrow as a house surgeon, you can go to a primary health center, do a venesection and tell the villagers that you are the father of vascular surgery. So that's the reason, doctor, the enjoyable period of 3 months of paid holiday called the SPM posting is the time where you will enjoy a nice village rural life, completely peaceful. Same time prepare for the exam. Germ cell tumor, which is not common in young individuals, is lymphoma. Germ cell tumor was asked. Oh, I think testicular tumor should be the better wording. Sorry for the wording. Yeah. Most common bone secondaries कहाँ से आएगा? Basically 80% of metastasis, primary carcinoma, particularly of the breast and prostate. And most common primary source of a solitary skeletal metastasis, only single lesion found. आप कहाँ देखना पड़ता? किडनी को देखना पड़ता, carcinoma of the kidney. Most common site of the bony metastasis in carcinoma of breast, where will it go to? It will go to lumbar vertebrae. And which quadrant is most likely to? Upper outer quadrant. Then what are osteoblastic? In males prostate, females breast. Most common secondaries originate. So the point is prostate se originate hota, breast se originate hota. Overall if you liye to men are more or women are more? One prostate, two breasts. Chances of breast carcinoma going to metastasis is much higher. Murali told that. Huh? Yeah. Then carcinoma prostate arise from typically the posterior lobe. BPH arises from the periurethral transitional zone. C, gull sign is basically gallstone, is where the gas in the gallstone will give that Mercedes-Benz car का look देता है. Then hypertrophic pyrorexinosis, which antibiotics से आता है? Unless you have not done this MCQ previously, you can't guess it in exam hall. Erythromycin. Next time be careful to take or subscribe erythromycin to the pregnant women. Huh? Most common cause of testicular torsion. Classically there are two types, intravaginal torsion, extravaginal torsion, tunica vaginalis. So bell clapper deformity means intravaginal torsion is more common, is what you have to basically remember. Where will you give mantle radiation, doctor? Hodgkin's lymphoma, basically extended field radiation it is called as. Mantle field radiation means the way we deliver the radiation. Guillain-Barré is post-infectious polyneuritis, demyelinating. But it is which infection? Campylobacter, herpes, CMV, Epstein-Barr, Mycoplasma pneumoniae, swine flu, rabies, etc. etc. Even can lead to demyelinating polyneuritis. Hodgkin's, HIV, seropositive T and SLE. Then Miller-Fisher is a variant of Guillain-Barré. Miller-Fisher में क्या क्या दिखाई देगा? Ataxia will be there and areflexia without weakness and ophthalmoplegia, often with pupillary paralysis. It is the variant of the Guillain-Barré which is then called Miller-Fisher, is what need to be remembered. Which situation where central venous pressure will rise, doctor? Obviously when the heart fails as a pump, jugular vein fails to deliver, drain into it. That lead to rise of the jugular venous pressure. Salivary gland stone is very common where? Typically in the submandibular gland. And uterosigmoidostomy classically will lead to normal anion gap metabolic acidosis. One of the causes is renal tubular acidosis, diarrhea and uterosigmoidostomy. So it leads to hyperchloremic, hypokalemic acidosis, which is typically of the normal anion gap, is what need to be remembered. Carcinoma of the anal canal, what is the most modern treatment of choice? It is the chemoradiation. What is that called? Negro's protocol. Nothing to do with Negroes, but Negro. Negro is the name of the guy who discovered it. Next examiner, they will ask which country he belongs to. Don't tell Africa. Injection sclerotherapy is the ideal for which type of hemorrhoid? Basically, first degree internal hemorrhoids which bleed, and early second degree internal hemorrhoids can also be treated using the injection sclerotherapy is what need to be remembered. Migratory thrombophlebitis, what are all the tumors associated? Pancreatic cancer is most common, doctor. Is it called Trozier or Troisier? Troisier is left supraclavicular lymphadenopathy in gastric carcinoma. Trozier, SSEAU. Then lung cancer also can lead to migratory thrombophlebitis. Congenital megacolon, rectal biopsy is considered to be the gold standard investigation. But there is one small fix in this. We have absence of ganglion cells if you do rectal biopsy. Aganglionosis leading to megacolon is basically what? Your congenital megacolon Hirschsprung. But hypertrophied nerve bundles will be there. This hypertrophy of the nerve bundles, don't forget. Another favoritely asked question. What happens to nerve bundles on biopsy? Proteus infection ho gaya to what will happen? Big stone staghorn caliculi will form, and that is composed of what? Phosphate, ammonium, magnesium, phosphate, triple phosphate. Then doctor, James K. Steiner, who started advanced trauma life support. What was he? He is a husband, he is a father, he is a drunkard. So you should also know personal profiles, Facebook profile of the forefathers. So that earlier question was a bouncer. This also will be a bouncer, unless of course in our mock test exactly 145th question means we will go for orthopedics. So orthopedic surgeon, right? Don't look the question below it and then answer. Below question is orthopedics, ye bhi orthopedics ka hi hoga, common sense, uncommonly available. Then ring sequestrum kya hota hai? Skeletal pin tract osteomyelitis is basically ring sequestrum. Then you have two types. Chopart means mid-tarsal, Lisfranc means tarsometatarsal joint amputation. Sims is through the ankle joint. Ray is removal of the finger with respect to metacarpal from the carpometacarpal. Krukenberg is making forceps with two forearm bones. At the time of amputation, with the two forearm bones, if you make a forceps, he can still be able to work, which is then called Krukenberg's amputation. In osteoarthritis, you don't see the presence of erosion. Erosion is generally seen in inflammatory arthritis. Exception is SLE. SLE, though inflammatory arthritis is non-erosive, but osteoarthritis is non-erosive in nature. Then doctor, what stabilizes a joint? Tendon, bursae, ligaments, they all basically stabilize. Smith's fracture is opposite to Colles. So typically it will involve the distal end of the radius at the cortico-cancellous junction. Only thing is Colles में dorsal displacement होगा, इसमें ventral displacement होगा. Right superior oblique, हाँ doctor, extraocular muscle actions. Favorite topic for the examiner, which you have to answer with 100% precision. Huh? Yeah. Srinivas says, sir, you need to look at the chat window also. Yeah, I know. So, actually, I can include some more quiz questions to make it interesting, but you had been laboring since afternoon 2 p.m. So, Sunday we will have a longer discussion. So, doctor, all obliques abduct. All obliques superior oblique, inferior oblique, उनका काम क्या होता है? Abduction. Horizontal recti adduct, then all superiors, whether it is superior rectus or superior oblique, all superiors intort, all inferiors extort. Inferior कौन होता है? MD first year resident he is extrovert. Superior कौन होता है? HOD will put a constipated face on the ward rounds. We don't know what is there in his mind. आज वो प्यार कर रहे या नफरत कर रहे मालूम नहीं, दोपहर 2 बजे को मालूम होगा, तब तक टेंशन है. तो all superiors are introverts, intort, all inferiors are extrovert. Then dextro elevation, dextro depression. Dextro depression is caused by superior oblique. So I leave the literature for you, the tables, and just review that. Cornea sclera के बीच में क्या फर्क है? Cornea is basically what? Regular, whereas this is irregular. That's the reason cornea is different from sclera. Sclera is that white part which is not transparent. Most common ocular complication of mumps क्या होता है? Dacryoadenitis is what you typically come across. Then sunflower cataract, chalcosis. Then oil drop is galactosemia. Then Christmas is dystrophia myotonica. Rosette shaped is blunt trauma. Glass blower is infrared. By now I think you are ready with Kausalya, Supraja, Rama in the morning with the list available. So you should personally judge and keep 300 to 400 lists for the exam. Your personal lists. Another 100 days, रोज 2-3 लिस्ट जरा एक बार देखना. That's how you have to survive the 10% or 20% of exam which is list based exam, enlisted exam. Brinkel arch derivatives, अगर वो लिस्ट आपके हाथ में रेडी नहीं है तो even if you are a super duper Dr. Einstein also you can't do anything in exam hall, right? So but you keep your own personal list of that 250, 300. I will also give you a list that you need to keep along with your cut it and then take it to exam hall, whatever you do. Then in recurrent chalazion, what is the big worry? Sebaceous gland carcinoma. Krukenberg spindle, where do you see? Typically whenever there is a pigmentary glaucoma, which is an example of a secondary open angle glaucoma, there is a dispersion of the pigments on the corneal endothelium in a vertical spindle like pattern, which is then called Krukenberg spindle. And if you do gonioscopy, you will find that pigment distributed along the Schwalb's line, which is then called Sampolacci's line, is what need to be remembered. But this is a good question. अगर Krukenberg और एक बार state MD में आ गया तो only you will be answering, nobody else. Take it as my word. Then non-granulomatous, granulomatous uveitis, एक table ready है आपके लिए. Differences क्या है? Acute onset is non-granulomatous and ciliary congestion is marked in non-granulomatous. Keradic precipitates are fine white lymphocytic in case of non-granulomatous, etc., etc. What do you call green color blindness? Basically deuteranopia. Protanopia is for the red color and tritanopia is absence of blue color. Then laryngeal TB, how does it basically present? Most common presenting is difficulty to swallow and hoarseness of the voice is what you need to basically remember. You also find nibbled, mouse nibbled appearance, turban, वो सब है ना. तो TB larynx, lupus larynx. Lupus larynx also is important for the state MD entrance. Dangerous nasal triangle above the philtrum. Any injury to it will lead to direct spread of infection to cavernous sinus. Coggins, what does it contain? Unilateral deafness along with keratitis and vertigo. Vidian neurectomy, where will you do? Vasomotor neuritis. Anybody answered atrophic allergic rhinitis? कोई होगा? नहीं होए. Modified young is in atrophic rhinitis, Ozina is what need to be remembered. Nasopharyngeal carcinoma, what is the best treatment? Radiotherapy any day. Ethmoidal sinus drains into middle, and ASOM myringotomy typically in posterior inferior. Then acute this is a beautiful question. Acute retropharyngeal abscess children में different होता है, adults में different होता है cause. Children में cause होता है suppurative retropharyngeal lymphadenitis which is due to upper respiratory tract infection. Adults में cause is presence of Kerry spine is what you need to remember. G2P1 lady, I think Gynob's questions of UPPG are really interesting. Little more tougher. G2P1 34 week with PROM. What is the treatment? First of all, whenever there is any PROM, doctor, premature rupture of membranes. Is she a term lady or a preterm? Term कब बोलते? 37th week हो गया, rupture of membranes हो गया. You call it as term PROM. Before 37 weeks, you call it as preterm. Then what is the definition of prolonged rupture of membranes? Generally rupture of membranes होने के बाद within 26 घंटे labor pain should begin. अगर शुरू नहीं हुआ, so rupture of membranes for more than 24 hours before the delivery you call prolonged rupture of membranes. Now rupture of membranes हो गया and your patient is term lady more than 37 weeks. What do you want to do? You can induce the labor after giving antibiotics if not given earlier. You have to give antibiotics if needed to prevent the group B streptococci infection and then induce labor. Huh? Is given only for preterm, you want to say? No, anyway, any time rupture of membranes ho gaya, if the labor didn't start. True, but the point is in spite of a recommendation that until 8 hours, still clinical practice mein antibiotics are basically given once rupture of membrane occur, and of course that's the reason we are saying if needed to prevent. Not in all cases, but if there is a prolongation of the onset of the labor, then late preterm 34 to 36 weeks, even for them you give the antibiotics and induction. Preterm 24 to 33, what will you do? You will do watchful waiting, expectant management, antibiotics to prevent the beginning of labor, one-time dose of corticosteroids, and not antibiotics to prevent, you need to give tocolytics to prevent the beginning of the labor, antibiotics if needed to prevent GBS transmission 24 to 33, that is the protocol. If it is pre-viable less than 24 weeks, then the patient require basically the counseling, and there is an indication for tocolytics, max sulfate, antibiotics and steroids. So that's part of the protocol. Now doctor, what is not included in third stage of labor? आप मेथर्जिन दिए तो what is the route of administration? IM, not IV, is what you need to basically yes, Praveen is proposing, sir, what is GBS? Group B streptococci. Exactly what was the Praveen's question? Praveen can shoot the question? Oh, Praveen has a video problem, just ask to check. We are having around 70 plus online viewers. Maybe Praveen need to restart his video if it is freezing. it is due to the local internet connection. Now that's the point. Then doctor, max sulfate is contraindicated in which situation? Basically respiratory rate less than 14 or more than 24, not less than 16. Too much, no? Huh? So actually at least it should be some 20 or something, we would have guessed it and our eye might have gone there. So that's the point. Then use of OCPs, it decreases the incidence of all these things but not hepatic adenoma. In fact, they are implicated to be responsible. But what are all the clearly established benefits of the OCPs? Reduce ovarian cancer, endometrial cancer, ectopic pregnancy, benign breast disease, functional ovarian cysts, etc. etc. Then hypertension hai, pregnancy hai, what is the best treatment? Methyl dopa, enalapril is contraindicated. You can give methyl dopa or labetalol. Labetalol is also there. But between the two, labetalol is more preferable than methyl dopa. I'll check this. I'll check that. I didn't go to that level of thought process. Best measurement to predict the fetal macrosomia is which one? Yeah. Is the freezing issue, video problem is there for everybody? Is it clear there? Somebody is monitoring? You ask someone to monitor. Can the online students can punch whether the video is clear or is it freezing? Anu, Ambi, Shravan, Manasa, yes means clear or not clear? Clear, that's good. Right. We use abdominal circumference, BPD, femur length, head circumference in order to predict the fetal weight is what you need to basically remember. Right. Since for a good number it is freezing, just restart the video.